So we are going to be talking about using active pause in therapy. And to do this, we're going to use a little stress ball, something like this that you can squeeze. So if you don't have one, you can use a tennis ball. You could use rolled up newspaper, rolled up paper, socks, any kind of object. Ideally it's something that you can kind of squeeze, that's not too big, but something that gives you a sense that essentially having a hands-on experience. This, making a little bit of a pun about hands-on, a little bit of a pun about get a grip, but this is essentially what it's like to going into the physical experience of touching something. And actually, in the way I'm describing it, when I say the physical experience of touching something, it's not so much the something that you're touching, it's actually what it feels like to be touching it. What you're experiencing in your hand as you feel your hand around the ball, and as you feel the hand squeezing a little less, squeezing a little more, what it feels like as you shift the ball from one hand to the other. So you give clients a simple explanation. You're not expecting them to necessarily do it right, quote unquote, the first time. It's not about doing it right. It's actually just about introducing that element of experience. So the simpler the explanations, the better. Sometimes I've had clients who, during the whole minute that I'm doing, this active pause, they're staying with one hand, okay? And they didn't get the idea that it's from one hand to the other. And that's okay. Just, again, it's not something that has to be accomplished in a certain way, but it's about a vehicle to get into the experience of paying attention to the embodied experience. So maybe, as I am giving you the instruction, ideally, if you have the ball, you're following me, so you just hold the ball, you squeeze a little, one hand, you close your eyes, and you shift to the other hand. You feel it in the hand, you might give some kind of a gentle squeeze, and then go back to the other hand, and so on, and so forth.